how do you begin to identify abnormal neurology when it comes to your patients with POTS or MCAS?
Right. And we're really careful here because we see everything here. Okay. But when a patient or a doctor suspects POTS and they call us, the first thing we do is make sure it's not a heart problem, right? A cardiologist does need to rule that out. And assuming the structure of the heart is good, we also want to make sure it's not a neurodegenerative condition, okay? Because those patients can also display as POTS, and then it quickly morphs into other things like muscle control goes wacky, and but you can't afford to miss those. We had one patient who the doctor said it looked like POTS. Her heart rate would go up when she was vertical, but she didn't fit this pattern that we usually see. And instead, it was an autoimmune condition that initially affected neurology, but it ultimately caused encephalitis and it killed her. So had that gotten missed and she'd gone down a routine POTS treatment, it would have just been something I could not have lived with. So it's important to screen those out. But inflammation does affect the immune system, right? And then the immune system does tie into nervous system. So, for example, one big thing we discovered was certain aspects of inflammation, certain cytokines and chemokines can block the release of acetylcholine at the site of the vagus nerve and other parasympathetic nerves, and ultimately cause those organs to start to fail. When that's identified properly, if it's treated as a neurological condition, you can't get it going. You've got to treat the inflammation that's keeping that nerve from working, and it can come back.